The road to recovery after any sort of concussion or any type of brain injury can be one that is full of ups and downs and unexpected twists and turns. And today, that is what we are talking about. We're going to be discussing the setbacks and the flare-ups and the re-injuries and all of these unexpected bumps in the road that can hit after brain injury, and maybe take some of the unexpected part out of that for you, because these are things a lot of people don't really talk about a lot. But I also want to talk about the wins and the celebrating and the victories that we experience along the way. So our special guest is Dr. Brittni Charle, and I'm so excited about this episode. Thanks for tuning in. Welcome back to Hope Survives podcast. I am so excited about today's episode. But you know, what's interesting is before we even get into the conversation about the road to recovery and setbacks and flare-ups, I need to tell you that I had a symptom flare-up last week. And it's so interesting because we have Dr. Brittni Charle in the podcast today as our guest that's going to be interviewed. But in this episode, as I was editing it this week, I was listening to our conversation. I was like, wow, we had the conversation a couple weeks ago. I had planned to get it out last week, but I had a symptom flare-up that prevented me from getting the episode out on time. And so it's coming a week later, and now we're talking about this. And one of the flare-ups we were talking about is what can happen when you get sick, if you get a cold or a fever, anything. And I actually got sick last week. And so a lot of times for people with brain injuries, if you get sick, like any sort of normal sick, I mean, it makes anybody feel bad. Nobody likes having a fever and being sick, but especially with a brain injury, it can bring up all your brain injury symptoms, and you can have flare-ups from like a common head cold, and it just makes everything else so much worse. And so that's kind of what happened to me last week. And I was just kind of laughing that that's what happened. And I was being so hard on myself because March was Brain Injury Awareness Month. I took a year break from the podcast, and I wanted to come back with a bang and hit every Friday in March in Brain Injury Awareness Month. It was a little goal that I set for myself, and we got 4 out of 5. And I posted it on the Hope After Head Injury Instagram. If you're following me there, I do a lot of updates on there on the stories. And I wrote, I'm trying not to be hard on myself and realizing 4 out of 5 is probably okay. And I got so many kind responses. And I realized that the advice I would give on the podcast, or the advice that I would give to any of you, if you were to call me up and say, hey, I'm having a flare-up this week, I would say, hey, is it life or death? You can totally take a break from your podcast and it'll be fine. But for me, I tend to be harder on myself. And so just some encouragement that if you tend to be hard on yourself, to remember to speak to yourself like you would speak to a friend, like you would speak to a loved one. If they came to you and they were struggling, what would you say to them? And treat yourself with that kind of kindness. And so that's what I am attempting to do here. Now, I do have some news. I have chosen along the lines of treating myself with kindness and learning my limits that going forward, we are going to have episodes every other week. I apologize to those of you who look forward to them each week. However, it's just not sustainable with my current season of life and my traumatic brain injuries. And I don't want to burn out, and I don't want to stop the podcast altogether. So I have to go at a bit of a reduced pace. Now, there might be some weeks that I have a really good symptom week and I can get out a bonus episode, and I will attempt for that to happen. But more regularly, we will plan on them being every other Friday from now on. And I just want to thank you for your support in honoring that decision, and just for being here. I mean, I'm still amazed at how many of you actually listen to this each week. And I've said this before, but I'm so passionate about making this podcast and sharing my heart and these resources because I didn't have any of this when I got injured. And so I'm so glad that you are here and that you know you're not alone. So, along the vein of that, we do have Zoom groups once a month. If you have listened to the podcast before, you know, but I always like to remind us that we have our Zoom support groups. So our next April support group, you can sign up at hopeafterheadinjury.com/community. By the way, I know some people listen to podcasts much later, so you might be going, I'm listening to this and it's October. What do you mean, April? And I'll tell you, we will definitely still be having, God willing, podcasts or Zooms. Gosh, okay, I'm forgetting my words. We'll still be having Zooms happening then. And so if you just visit hopeafterheadinjury.com/community, we meet one Tuesday a month, usually the second Tuesday of the month. And then the Brain Injury Bible Study Group meets on Zoom one Saturday a month, which you can find at the Brain Injury Bible Study link on the Hope After Head Injury website. So I hope to see you guys on Zoom. Now let's get into Dr. Brittni's episode. So I wanted to share, where is... Now let's get into Dr. Brittni Charle's episode. So I'm going to share a little bit of background information on her. Dr. Brittni Charle is a doctor of physical therapy, and she's practicing in outpatient neurologic rehabilitation. Through experience and training, she has developed a specialty around treating concussion, persistent postural-perceptual dizziness, PPPD, functional neurologic disorder, Parkinson's disease, and stroke. She is the Concussion Program Director at Reactive Therapy and Wellness, an interdisciplinary clinic consisting of physical therapists, occupational therapists, psychologists, yoga instructors, and personal trainers. She's also taught international courses for clinicians related to concussion, PPPD, and Parkinson's disease. She's awesome. You guys are going to really enjoy this episode. So I hope that it's an encouragement to you on your road to recovery, or if you're listening to this as a caregiver or family member, that is an encouragement to you to know that there is hope on the road to brain injury recovery. Today, I am welcoming Dr. Brittni Charle to Hope Survives podcast. Welcome, Dr. Brittni.
Thank you so much, Cristabelle. I'm so excited to be here.
I'm so excited to have you. We were just chatting a little bit before we hit record, and I think we've been messaging for a couple years now, thinking about coming on the podcast, and just timings never worked out. And it's just like, well, now's the time. So I'm so glad this finally worked out, and I cannot wait for our listeners to get to learn from you. And I can't wait to learn from you today. So thank you for taking the time.
Oh, thank you. Likewise. I mean, this is such a great platform. So I'm excited to just be a part of just a small piece of what you're doing here, which is inspiring hope, providing things that people aren't able to find elsewhere.
Oh, thank you. That's really kind. So why don't you go ahead and introduce yourself? What led you into PT? Why did you decide to go to PT school? And then a little bit of your practice.
Great. Okay. So yes, I'm Brittni Charle. I'm a physical therapist. So let's see, the original reason that I got into physical therapy was actually through sports. I had a friend my best friend at the time, who had gotten injured repetitively through sports. And I kind of saw her life in a nutshell spiral downward. And so I just realized how interconnected all of components of our lives are, and just how much of a change I could make for somebody physically, how just them being well physically was going to help improve their emotional, spiritual health, like all the things, right? And so that was really what got me started. And my journey into concussion is very organic. So it just happened very naturally. And I think that's what also helps me maintain my passion, is that it was never something that I was forced to do, or that it was nothing I was trying to mimic. So what I noticed was, just in school, we have to do different rotations before we graduate. And so I had decided, well, let me do a setting in the neurologic setting, because, I'm going to be in orthopedics all my life. So I might as well get a look at the neurologic side. And while I was there, I actually became so intrigued with treating the vestibular system. I thought, I would see people who were dizzy, and dizziness, as you know, and many listeners know, is not something that the average person can detect with someone. It's not always easy to see that somebody is dizzy. And yet it's something that's completely disruptive of one's life. And so I thought, wow, this is like such important work. If I can get into vestibular rehabilitation, this is going to really help people to not be dizzy, right? And so while I was at that clinic, I then encountered, first it was some concussed athletes, and I went, well, this is cool. This is like kind of combining this new interest in vestibular therapy, and then I already liked sports, and so I was like, I think concussion stuff is kind of what I want to try doing. And so, of course, the more I dove into it, the more I got exposed to treating post concussion. I started seeing people of all kinds of backgrounds, people who are not just athletes, parents, students, just whatever, engineers, all kinds of things. And it was I still had that same, satisfaction of like listening to somebody who's telling me about symptoms that I can't see. Yet when we're improving, you see that person light up. You see them become themselves again, right? When they learn to start managing some of those invisible symptoms. So I just kept going with it. And so I, to this day, so since I was a PT student, into my first job, I told my boss, I was like, I want to create a concussion program. So I've been doing that ever since, just at the different places I've been. So right now I work at Reactive Therapy and Wellness. So it's an outpatient neurologic clinic. So we see all kinds of neurologic conditions, but I specifically direct our concussion program. And so I have the pleasure of working with all kinds of people who are in multiple stages of their healing post concussion. And it just looks different for everybody. But again, it's just always so rewarding to just see people become themselves again when they're not so bogged down by these really disruptive yet invisible symptoms.
Thank you so much for sharing. I think that one of the biggest challenges for survivors that I hear over and over again in our Zoom groups and when I talk to other people with brain injuries is finding a good provider. And so having a passionate provider like you, and you didn't even have personal experience with concussion, but you just feel so driven to help people. That's what this world needs. So thank you for doing that, because there's a shortage of good concussion providers out there, I think. And I'm so grateful that you decided to follow this path. And I just love hearing how you phrase seeing people become themselves again, because there really is a loss of self when you lose like cognitive abilities or like even your balance. So many people, it affects you every day. It affects you as soon as you get out of bed until you go to bed at night. You are affected by these symptoms. So what are some like symptoms that you see a lot in people, and what are some ways that you have seen people, like success stories or things that you have seen people improve on?
Yes, luckily there are lots of success stories. So the number one thing that I see is headaches post-concussion. The second symptom that's most common is dizziness. And then from there, just from my own experience, I tend to see neck pain. But there's a whole host of symptoms people can have. So as far as cognition, that can present in the form of difficulty concentrating, or maybe other symptoms that the person has specifically increase when they're doing something cognitively challenging, like studying, or maybe some sort of job that requires just a lot of cognitive power or efforts. And then, we can see fatigue is a huge one as well, right? And then balance issues, a lot of emotional dysregulation. So that can present in the form of anxiety, depression. Maybe the person is irritable. And then we have all kinds of sensitivities to different types of stimulation. So maybe light sensitivity, screen sensitivity, noise sensitivity, and even just if too much is going on at once, regardless of what the stimulus is. So there's a lot of things that can happen, and people can have a host of all the things, certain things, right? So, but luckily, yes, there's a lot of success stories that I've come across working with people, and they're really just, they come in all shapes and sizes. So I see people who have had their concussion maybe just a month before seeing me, right? But then I've seen people where they've had post-concussive symptoms for years, for several years, and maybe had treatment or didn't have treatment. But what's great and what I love to tell people is that there's no current research right now that is able to say that after a certain point you can't heal, right? Researchers just, they keep including people who are further and further out from their concussion in these treatment protocols, and we're seeing improvement. So it's more about finding the type of treatment that is appropriate, which we didn't always have in the past, right? Our previous protocols were what we consider now to be counterproductive. And so, we want to go into those. You might have had those protocols that weren't appropriate before. And then when new things come out, you go, wow, I've been doing completely opposite of I'm being told now, but you were told to do those things
Yeah.
before.
Yeah, that's such an important point. And that really was a lot of my experience. And so, when they used to say, go in a dark room and rest and do nothing, and now the protocol is completely different with symptom limited activity and as tolerated exercise and things like that. And so, yeah, that's so important. It just brought to mind, I like how you pointed out when you get the right treatment for the right thing. And for me, it was 11 years after that I got the correct treatment for my dysautonomia. I got dysautonomia diagnosis, and I started to get vestibular and vision help for things that I had been struggling with for a decade. And then in the last couple years, I've had the most improvement like post 10 years. So my most improvement has happened post 10 years. So you are absolutely right that there's no timeline on healing. So, let's talk about this road on concussion recovery. So, what kind of things do you see people experience on their journey and on their road? I know we wanted to talk a little bit about flare-ups and, different ways that healing can look for different people. So, why don't you go ahead and just take that away?
Yes, no, I'm glad that you brought that up. So flare-ups, let's kind of define flare-ups for people if that term doesn't resonate with them. So a flare-up would be any sort of period of time where you're experiencing a worsening of symptoms in some way, a worsening of your post-concussive symptoms. So maybe they're more intense or they're more frequent, they're taking longer to go away. That can sort of be considered a flare-up. And so flare-ups, I find, tend to be pretty scary for people healing post-concussive because it begs a few questions. Am I getting worse? Am I not going to get better? Am I doing something wrong? Right? Is kind of what people tend to ask when I'm working with them with flare-ups. And so honestly, what I've started to do now when I work with people is I have that conversation about flare-ups before we even start working together. And I basically communicate the fact that flare-ups, it's not if they're going to happen, it's when they're going to happen. So flare-ups are going to occur, and there's reasons for the flare-ups to occur, and there's actually a lot of good information that we can get from flare-ups. So usually we're getting a flare-up because we're pushing the capacity, right? Meaning we're trying to get better. We're trying to get back to certain things. If you are just kind of steady with your symptoms, you're not having an increase or a decrease, yeah, you're not going to have a flare up, but you're probably not getting better. Right. And so I've worked with people like that have told me, everything's very even keel. Like I don't do anything that's going to make anything worse. And I go, okay, great. Are you satisfied? Are you happy? And I'm like, no, I can't do this. And so I'm like, okay, so we're going to work together to try to push towards those things. And you will probably experience a flare up. But what we're going to do is learn how to manage those flare ups. And we're going to do our best to not have flare-ups that are occurring daily, right? And not have flare-ups that are making you spent for several weeks or several months or something like that. But those flare-ups are communicating to us that, okay, the brain is, being challenged right now. So I really like to talk about flare-ups and just let people know they're going to occur, but they're okay. They're a sign that you're working hard, and then they help us to scale. So maybe going for a walk for 10 minutes wasn't bothersome, but going for a 20-minute walk caused a flare up. Okay, so we know that 20 minutes, we're not currently there, but we're somewhere in between 10 and 20, right? So it gives us wiggle room. It informs us. And then we go through, okay, well, what was the symptom and when did it occur and how can we adjust? And then, the exciting thing is when you start hitting those points where you previously experienced flare-ups and you're no longer experiencing flare-ups, right? So that's like one way that you might notice recovery.
Yeah, I love that reminder that we have to also be aware of our symptoms. And I try to tell people to keep some sort of simple journal, if they can, or some way to document your symptoms and your flare ups, because I know from my experience being in it, when I'm having a flare up and I feel awful, the last thing I'm thinking about is, what did I do? And how many minutes did I walk? I'm just like, I feel horrible and I can't even get through today. And how am I going to get the dishes done? And how am I going to have the energy to take a shower? And so it's like, do you have any tips for people on how to be a little bit more self-aware, and how to, how would someone go about documenting their flare-ups, or how would someone go about being a student of themselves to help themselves to heal better and to reach those milestones?
Yes, I love that you mentioned too about how self-aware you need to be, because I would argue that that's your most powerful weapon in healing post-concussion. Like if you can be self-aware, that's going to be so helpful in knowing when to scale back, when to move forward. And so, like you said, the last thing you might be able to think about is, okay, how can I move what is this flare up trying to tell me? I need to get the dishes done. I'm tired. I'm all these things. And so a lot of times my first thought is, well, two things. One, I should say during a flare up, I like to kind of pour back into myself is what I'll tell people that I'm working with. Just you're not feeling good right now. And so, yeah, the last thing you might want to do is strategize, show yourself grace, remind yourself about certain things, like the fact that this will pass, that this is not indicating that you're moving backwards, things to just kind of calm the body down and not, because you don't want that flare up to push you further into this fight or flight state, where you're panicking about what happened. Maybe you're beating yourself up because you tried to walk those extra 10 minutes. Don't do that, right? So just pour back into yourself. A lot of mental visualization that this is going to go away is kind of the first place that I start. But what I also like to do from a treatment standpoint as a clinician is regulating tools first, so that when somebody, before kind of pushing and trying to build capacity, so that when those flare-ups do happen, the person can pull out that piece of paper or that note on their phone that's showing what their regulating tools are. And so you can start there, like, oh my gosh, I'm feeling awful. What can I do to make it better? Okay, go look at that sheet that says, okay, let me do such and such stretches that help me. Let me do such and such breathing techniques. Let me, put my phone away for a few hours, or whatever we've found is helpful for just reducing symptoms. That's also a great place to start.
I love that. So you said, did you call it regulating tools?
Yes, regulating tools. So just things that are going to help you as far as, yeah, I say regulating in terms of, so if something's going up, you want to be able to bring it back down, or if you need to increase stimulation. So just regulating, keeping you, yeah, at a level of functional state, right?
Yeah, that's great. Thank you for sharing. I think flare ups can come in different ways. I find in my own experience, there could be something that will mess me up for that day. And then, for example, at the beginning of this month, I went to DC for advocacy day, and I was like not right for over a week, more than that, because I was so exhausted from this multiple day trip, and I pushed my brain so hard while I was there that when I got home, I was just like out, and I didn't sleep well, and like all of these things that contribute. And so for me, like, I think what I found is learning what are my specific triggers. Nutrition is a big one for me. If I don't eat right, if I'm not hydrated, that is like one of my biggest ones. And then not sleeping well, and then overstimulation or pushing or overdoing it. And before I learned I had dysautonomia, I would try and go for walks and exercise and like go to the gym to try and like help myself feel better. But I didn't know I had exercise intolerance. And so once my heart rate got past a certain point, I'd be like dead the rest of the day. And so, it was learning that, oh, wow, okay, I have to learn how to do symptom limited and low intensity to moderate intensity exercise that, doing like weightlifting for 45 minutes is too long. Like my cap is like 30. And I had to learn that if I push it too hard in those moments, I'm going to be messed up for the rest of the day. And so it's like learning how I like how you were describing, where do you push it a little? Where do you not? Like, because I've had to learn those things, and it's helped to have much more successful days and more successful weeks.
Yeah, that's exactly right. I mean, and it's hard work, right? It's not easy. It's especially with the flare-ups. It's a lot of up and downs. The recovery, it's not this perfect linear upward trend. There's a lot of dips, but it's obviously worth it, right? For you to be able to get to that point. So I just encourage people to try, when you can, right? Sometimes you're not going to have the energy for it, but I like how you said too, you've noticed that just hydration, nutrition, sleep are big things. I think sometimes people forget that concussion it's an issue with the neurometabolic system. So it's not just like the stimulation stuff, right? Our metabolic systems are most influenced by sleep and nutrition, those kinds of things. So that there's a lot that you can get done there. And then when you were saying too, with being in DC for advocacy, you were there for multiple days that kind of required you to be at this level that maybe your typical day at this time maybe is not usually. And so I think of it, I'm kind of the queen of metaphors when I have my sessions with people, and it makes me think of a cup of water. And so it just depends on how much it's overflowing is going to kind of dictate how much recovery is needed from the flare up, right? So if you have a cup that's on your kitchen counter and it's spilling over slightly, like let's say it spills over for half a second. Okay, so there's probably only a little bit of water near that cup, right? And you can quickly just grab a towel and you can pat it down. But if it's been overflowing for 5 whole minutes, chances are now that the water has gone over the sink, now it's on the floor, right? And so now you have to like get a mop. There's so much more recovery. And like you were saying, you notice, okay, I needed a week to recover versus maybe for other flare-ups that were a little less intense, maybe they required just a day or something.
Mm-hmm. Yeah. And also getting sick. Like I notice if you have a concussion, like if you just get a regular cold or a fever, that's like a whole flare up in itself. Like you need to recover from like, I don't know. It just, everything I feel like every single aspect of life is magnified when you have a concussion.
Yes, I agree. Exactly. Now, I had, especially a couple of years ago too, when people were getting COVID more often, we would have that and then it's hard because a lot of times it would increase post-concussive symptoms. So I even remember specifically seeing somebody who came in and they had a headache that was way worse than yesterday. I was seeing them daily. We were doing what we call like an intensive. So we were like seeing them for a short period of time, but like very frequently. And headaches were kind of her number one symptom. So we thought, okay, like let's look back to yesterday. Like, what did we do? Did you feel like this after our session? And nothing really seemed to make sense because I'd been seeing her for a little bit now. And then I think maybe her throat started to hurt later after the session, which was finally something that wasn't post-concussive. So ended up getting a test and realized that she had COVID. And so we're like, that's why your headache is so much worse. Right. And so then we took, at the time, the 2 week kind of break from people, the quarantining. And when she came back, she was like, yep, no, my headache's back to where it was, like when we were working together on just post-concussive stuff. But we had decided, like, let's take a break right now. Trying to push isn't going to be really effective. Like, your body's now fighting off this other condition. So yeah, I agree, where it's like, oh my goodness, adding another condition that your body has to fight just makes it harder. That's a good time to understand that you should scale it back.
Can we talk a little bit about re-injuries? So there's flare-ups and then there's re-injuries, and they are different, but they can maybe kind of sometimes present similarly. I always try to tell people, they don't like to hear this, but that re-injuries are often a part of the journey, because for me, I've had way too many, but it's because I had undiagnosed vestibular dysfunction. So I had terrible spatial awareness. Like, I'd walk into things. I still do that, but not as bad. But I always have like bruises all over my arms and legs from walking into door frames and stuff, and like hitting my head on stuff out of lack of spatial awareness, and also falling. And so can you talk a little bit about re-injuries and just what that process can look like on that road to recovery?
I love that you mentioned the spatial awareness, how that was contributing, because in my opinion, that's one of the last things and sometimes overlooked component of concussive rehab. So a lot of times the focus is on people being symptom free. And a lot of times people who are symptom free post concussion still have some proprioceptive issues that put them at risk of injuring themselves again, either through brain injury or some other orthopedic injury.
So they're not really symptom free. They're just like typical concussion symptom free.
Right, like you're still healing. You're still healing.
Yeah.
And so it's not appropriate to go back to certain things that you're doing. And it's not appropriate to stop all rehab. So but I think people chase that as like, okay, symptom free, done. And then especially as a clinician who can't see anything, right? They're used to you just telling them like, okay, you feel better? Okay, done. But it's not the case. And so I've seen that as well. Yes, where people are hitting their heads again. And a lot of times there's this issue of proprioception. And again, because usually that person is no longer like suffering from symptoms that they can maybe necessarily pinpoint, because sometimes you can't pinpoint that your spatial orientation is off, right? That's a subset of balance. Like, you might be able to tell that you're not walking in a straight line or that you feel unstable, but you might not be able to say, hey, that door over there, I might not clear that door until it happens.
Or corners or bed frames.
Right. And then it just
it's like
happens.
I live in this room and I walk into the corner of my bed frame all the time.
And you might not think, that might not be something you pinpoint as, oh, my spatial awareness. You might just go, well, okay, that was weird, and you just don't know. You just maybe don't have the term for that, but it's so common. And yes, re-injuries versus flare-ups are different. They are hard to discern sometimes, because sometimes you'll lightly bump your head on something and all your symptoms come back and you'll go, did I just concuss myself again? And probably not. Probably it was a flare up, right, in that case. But those can be tricky. And so I try to, again, make sure you have the proper tools for kind of getting yourself centered and regulating. And then obviously to seeing a specialist who can do a comprehensive examination to go, okay, yeah, these things we're going down the list, and it looks like all this stuff has changed in a way that would make me think this is a re-injury versus a flare.
That's such an important point, because I love how you brought up you bump your head a little, because I've done that before. and it was not a full concussion, but it brought back all my symptoms. And one of the ways I've heard it explained, I think we talked about this in like an episode forever ago, but that if you bump your head a little bit and all your symptoms you currently have got worse, then it's most likely a flare up. If you bump your head again and you're getting something new that either you've never had or you haven't had in like 6 months or a year, like a symptom that's returned from a long time ago that's acting like new that you haven't had recently, or something that's completely brand new, then it's most likely a new concussion. And I guess also the level of intensity, would you say, in terms of if it would be a new concussion or a flare up?
It can be. It can be. It just depends. Sometimes you can push so far past your current threshold, right? That your symptoms can get so bad, even though you didn't hit your head, there was no issue there. And it can seem like a whole new injury. So, yeah, you just have to take into consideration a few things that you mentioned. Did you hit your head again, or was there some sort of impact to the body or neck? And then, yeah, are there new symptoms? Are they increased? How long are they taking to go away? So all that stuff is, like you said, great things to consider when trying to distinguish.
Yeah, and it's hard. It's hard to figure that out because I have had both things occur. I'm in well into double digits on both of those because I've had a brain injury for 16 years, and the first 10 was just a big mess of not getting the right stuff. So not getting the right treatments, which is why I have a podcast now. I don't think if I went through all of that, I wouldn't even be doing this because I didn't get the right treatment, and I don't want anyone else to suffer that way, And so I just appreciate you sharing all of this. But I got a little sidetracked. An example of I hit my head coming up on, like, I was getting something off the floor and like it fell under my desk and I hit my head on the desk as I was coming up, and it brought back, like, I had probably like a week that I was just like not right, and I was terrified that I had another concussion. And what we didn't mention, we're talking about all this very calmly, but there's a lot of fear and anxiety when it comes to this. I was like terrified, and I was like, take extra fish oil, take extra magnesium, like eat no sugar. Like I was like trying so hard to like stay hydrated, sleep well, like do everything I possibly could. And thankfully it got better over that week and I returned to how it was before, but it took a long time. It wasn't just like a day or two. And then I had another incident a couple years ago where I slipped on the steps and I didn't hit my head, but I jarred my body. Like I got a big bruise on the side, and I jarred my body hard enough that my brain was jarred, and it caused a concussion. And I know because my vision changed and my eyes weren't working together. And I had already had vision therapy, and you get so disheartened when you like paid for all this therapy and all this stuff, and then you like get another injury and you're like, okay, like what is going on? But like my eyes were not acting right. Like there was stuff that was like way more intense than just like a flare up of my current. And in that case, I knew, and it was months and months and months and months. And I still have some lingerings from that one, which was like almost 5 years ago now, or like 4 years ago. So all that to say that those new symptoms that started then, that was a real new concussion. I didn't even hit my head. So it's like, those are just examples I wanted to share for our listeners, because you might be wondering, like, I hit my head. Is it a concussion? Is it not? I didn't even hit my head and I just fell. What's going on?
Right. No, and people have to remember it's the impact to the brain can be through the head or it can be through the neck or body. So the brain isn't just jolted by head movement, right? We have the whole rest of our body. And so, yeah, a fall, any type of collision, it could be at your hip, yet it jerked your head and your brain got rattled. So yeah, I agree. And like you said too, oh my gosh, the costs of things, right? Which is why it's so helpful. I'm hoping for listeners for your podcast that can go, okay, I shouldn't be sitting there in a dark room. I should actually be finding a pace that's ideal for me to rebuild capacity, right? Because the brain, it craves stimulation, but of course to a certain extent. So there's the issue of not stimulating it enough, that's not motivating the brain to change, to make changes, to kind of make what I call a therapeutic U-turn and to do something different. But then if it's too difficult, then it's disheartening, and that's when you experience the flare up. So I'm glad, yeah, that you're bringing up all of this.
Yeah. Thank you for sharing that. It's so refreshing to hear from a provider that knows about all this stuff. I mean, for those of you listening, like there's just so much hope that people like Dr. Brittni exist. I wanted to talk a little bit about, you had mentioned you're passionate about how recovery looks different for different people. Can you talk a bit about that?
Yes. So, and that's what's good to know as well. I think sometimes people, they might have an idea of what recovery is supposed to look like, and sometimes that can cloud one's vision and hinder you from seeing when you're making progress because it looks different. And at this point right now, we can't really decide what way you're going to see improvement. So, the probably the most basic way that someone would think is that, okay, my symptoms are going to just like keep reducing, right? It might be that the level of your symptoms stay the same, but what you're able to do on a day-to-day basis increases. Right. But you might be focused on, well, I have a 5 out of 10 headache every day. I still have a 5 out of 10 headache. And that's when it's nice to work with people, or you even mentioned if you're not working with somebody, being able to keep track of this in some way through journaling or through a calendar, some sort of tracking where you go, okay, I still have my 5 out of 10 headache every day, but before I used to only be able to do the dishes once a day. Now I'm doing the dishes twice a day and the laundry. So that's a form of improvement, right? Or your goal might be to get back to, I'll use the 20 minutes of walking again. And you're like, I'm still only at 10 minutes. You're like, but you don't have any more neck pain. You used to have neck pain when you walk for 10 minutes. Now you don't have it. Wait, right? So I think what we hope is that we increase the amount of activity and our symptoms reduce at the same time. And sure, that can happen. And that's also amazing. But that isn't the only way that you improve. What about flare ups? Maybe you're used to having flare ups a few times a month. And now you're noticing, okay, I'm doing the same amount of things that I was doing before, but I'm only having a flare up once a month, or I'm not having, it's less than a month every month that I'm having flare ups. Or maybe with your flare ups, they used to last a whole week, but now they last 2 days, right? So that can be a different way too, that the frequency or the duration of the flare up reduces, the frequency is reducing, symptoms, level of function are changing. So there's so many ways that you can improve, and each way should be celebrated. Like I said, I know everybody wants their symptoms to go down and their abilities to increase simultaneously. And we strive for that, but it might not happen. And those wins are still worth celebrating.
I love how you put that all those wins are worth celebrating, and just that our expectation. I love how, as you were explaining, how it's different for different people, and you might be able to have a more capacity to do a little bit more, even if you have the same symptoms. That's such an important distinction. And I also want to point out that I've been living with brain injury for a long time, and I've had different years and seasons where my own recovery has looked different. So after a flare up or a re-injury, you can't expect your recovery to look how it did before. It might look different, but being able to realize that, how I feel in 2024 today as I move forward is not maybe how I felt in 2022 as I was recovering, even if I have like a re-injury or a symptom or a flare up, or how I feel this week could look different than how I felt 2 months ago. And I might be experiencing it. And that's what's so hard about concussion recovery, because it's so nuanced.
Yes, no, exactly. And then what you said too, where when you have multiple injuries, you compare the different injuries. And even though it's the same body, right? Your body processes each injury injury differently. And so you have to remember that. I mean, take things from the past that are useful, right? If you have some sort of re-injury or a flare-up, go, okay, well, I know it was helpful for me to get vestibular rehab or vision therapy. So maybe you start with like consulting with those previous practitioners to move forward a little more quickly, but you might need different exercises, or the aggravation of symptoms might look a little bit different. So if you can, I know it's challenging, but if you can maintain this open mind to, okay, I've recovered from this, I can recover from this, even if the recovery looks different, I'm still that same person who is persistent, who has my goals, and can get through this, even if it has to be a different route than the previous time.
Yeah, thank you for sharing that. And I think setbacks are very hard. And like I said before, they're emotional because you feel like you've made all this progress and now you're back. And I love how we started this episode where you were like, hey, let's normalize flare ups. Let's just understand that they're going to happen. And we think about the metaphor of a road, there might be potholes, there might be speed bumps, there might be turns and twists and like a sharp left turn, or things might happen in a weird way, but you're continuing to move forward even if your road is presenting obstacles or looking different than you might maybe want it to or thought that it would. And there are also surprises, good surprises, of wow, I just did that. Or how did I just walk for 30 minutes and I don't have a headache? Or, I had a whole day where I remember my first day, I didn't have a headache. It was years after. I literally had a 24/7 headache for years. And the first day I did not have a headache, I went, what? Like, I forgot what it felt like to not have a headache. And it was such a crazy thing. So you might also experience unexpected smooth road. So to just be on the lookout for that too.
Yes, I love that. Oh my gosh, I love the unexpected realizations of, oh my gosh, I did that, or that didn't happen, or this did happen.
Yeah. So are there any other things you wanted to add about the road to recovery before we close?
Before we close, well, I mean, I'm so excited that we got to chat about this, because yeah, flare-ups are just so, again, just remember that these flare-ups are, they will occur, right? But they don't mean that you're going backwards. Let's see what we can learn from them to make proper adjustments so that we can move forward. So like I said, there's no research right now that's saying that people can't heal after a certain amount of time, right? And we've shared so many stories about how that is just not even not even a thing. So I encourage you to continue. I'd say consistency is, the brain craves consistency. So I think sometimes what people think, you have moments where you're more motivated than others, rightfully so. You're going to have times where you're not motivated versus other times. But what you want to try to do is find this level that where you can maintain your consistency. You're, being really motivated one day and doing like the huge list of rehab exercises that you have, and then waiting until next month when you're motivated again to do that is not nearly as helpful as picking two of those things per day that's on that huge list. It's way better to do a little bit and let it accumulate over time than to try to get it all done. And I know it's hard because we live in this society that promotes and pushes for being super duper productive. And if you don't get the thing completed, then you're less than. Try not to listen to that voice. Try not to listen to those things that are going on in the background that tell you that, because it's not true. That's not what the brain craves. The brain wants consistency. And if you can do a little bit daily, that's way better than trying to get the whole list done in one day and then you can't for days or weeks to come.
Thank you for sharing that. That's such good advice. Little bit at a time, right? So, what are your final words of hope if you were to speak to any survivors and families today? What would you want to tell them?
I would tell you that I believe you. I know these symptoms are happening. I know they're challenging, and also that you are capable. Okay. It might not seem like it right now. It might be hard to see that light at the end of the tunnel, but you actually touched on this, what I was going to say in closing. And what I want you to do today is imagine what it looks like to be better so that when you are, you can recognize it. Because some of you have had symptoms for so long and you might not have somebody there to tell you you're better. You know, it might be hard for you to actually recognize your recovery when it's been so long. So envision that next step of recovery, envision that next milestone so that you can see it when you're there.
Thank you so much for sharing. So helpful. If you guys want to get in touch with Dr. Brittni, your Instagram is a sense of stability. I love that. Is that reference to the vestibular system, right?
Right. And just everything in general, I feel like it's so disruptive to have post-concussive symptoms. So it feels like everything is just out of whack and not stable.
Yeah. Oh, I love that. So you can definitely connect with you if people want to. Where's your practice located? And if somebody wanted to say, I want her to help me, how could they get in touch with your practice?
Yes, yes. So I'm in the South Bay of California right now. So we're in Torrance. The clinic is called Reactive Therapy and Wellness. I'm usually pretty responsive on my Instagram. So if you don't look it up, but you could look up Reactive Therapy and Wellness. We do offer free consults for people looking to see if we're a good fit for them. So usually you'll end up chatting with me for about 45 minutes. And if, we think it's a good fit, we've had people come out from out of town. So right now, just I can only see people in California, but we've had people come as far as like Iceland to see us. So if there's an ability for you to pack up and come visit in Southern California for a little bit, then we'll be happy to see you.
That's great. Thank you so much for sharing. Thanks for coming on. And yeah, we'll keep in touch for sure.
Thank you. It was so great. Thank you for having me.
Absolutely. And again, I just want to say so much hope that there are providers like you that exist. So thank you for being a light in the concussion and brain injury rehab world. We need more people like you. And we just thank you for coming on the podcast.
Thank you so much.